Hey there, I wanted to take a minute and talk to you about the Synapse Dental Pain Eraser. When I first heard about these, I'll be honest with you, I was very skeptical of if they actually worked and if they would provide any sort of relief. And so, like many things, I went ahead and tried it out. But before I tell you about that, I want you to understand the science behind what this is and why it works. So basically, this is like a low pulse neural stimulator. And what that does is that when this is on, it basically causes the nerves of the teeth and the gums to fire. But they fire at such a low level that it's not painful. And what it does is it sends millions of these pulses really fast. And the chemistry behind it is it actually wears out your neural stimulator cells. So the nerves that would normally fire to make your teeth really sore, they've been exhausted, so to speak, by this device, which doesn't hurt. And then when they try to fire, there's not as many chemical messengers there in order for them to fire. And so that's how it works from a scientific standpoint. So how you can get relief with this, there's two ways. So one way you can use this is you can use it before you start getting sore. So the day you get your braces on before your teeth get sore, or the first day you get your aligners and start to wear those before the teeth get sore. You can actually just turn this on, little button on the top, this will turn blue, and you can go ahead and move this around and cover all of the different areas of the gums with the pain eraser. You'll want to make sure that when you're using the dental pain eraser that both of the little electrodes on the top are touching the gums. Sometimes you won't feel anything at all, but as long as you're doing it in that way, it's working. And other times you'll feel just a very slight tingle in the gums, and that will let you know it's working as well. Now, once your teeth get sore, you can use this in a different way. The way that I tried this out is I stopped wearing my retainers for about 3 weeks, and then I put them back in for a night, and the next morning my teeth were really sore. So what I did is I got the pain eraser and I moved it around, and you'll notice that when your teeth are sore, the nerves are already firing, and so when you place an additional stimulus on there, you're gonna feel it even more. And so what you'll wanna do is you'll wanna move this around until you find the specific areas that have more tingling. And sometimes it can actually feel almost a little bit painful, like it's a little bit of a shock if you find an area that's extra sensitive. But what you wanna do is once you find that area, you wanna just hold it there until that tingling sensation goes away completely. And once it does, you'll continue to move around, and when you find another one, you'll hold it there until that sensation goes away completely. And once you find all the areas, your teeth should feel pretty comfortable, okay? So it's not gonna be like 100% pain-free, I can't feel anything, but it's gonna take it from like an 8 to a 2. And so that's how you wanna do it, find all the areas. Once you do that really well once, and it might take some time, it might take 5 minutes, 10 minutes, 15 minutes, an hour, but once you go around and use that, that relief from the discomfort should last at least a day and sometimes 2 days. So give it a shot, let me know what you guys think, and hopefully this makes your orthodontic journey even that much more comfortable.